Welcome, let's get started. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update with Boulder County Public Health. It is our first update of the new year, so I want to welcome you to 2021. We will continue to have these sessions because things change pretty rapidly, apparently. If you were on last week's call with Jesse and I, you know that we had the announcement the day before that we moved to orange this past Monday. Jesse will give you updates on that. We'll give you our metrics updates, and we know there will be questions about 5-star. We know there are questions about immunization. We know there's questions about the grants. We'll try to answer as many things as we can. If we can't answer them, we'll try to get back to you with answers between sessions. As per normal, put your questions in the Q&A. I'll ask them on your behalf. We will not be making anybody live, so if you raise your hand, I will put your hand down. At this time, I'm going to hand it over to Jesse, and let's just get started.
Thanks, Corinne, and welcome everybody. Happy New Year. Just jump right in here. As usual, I'll go over the epidemiological data, our state dial status, and then public health order updates, and then we can jump into Q&A. So this is data from earlier this week. Used to be when we were on Wednesday, it was a little bit more current. Now we're a little further away from this, but I think the trend is important to see here. We are off that peak from November, but we are stabilizing it a little bit higher than we want to see if we want to stay at the level orange. So another way of looking at that from our municipality standpoint. Pretty much proportions are staying the same, the number of cases per community, but we are seeing that drop off for all communities, which is great. And again, as a community, we are pretty low we're the second lowest in terms of new cases in the metro area. So that's really good news for us. Key takeaways from the epidemiological data: our case numbers are steady, but rising slightly. Our long-term care facilities continue to see a large number of new cases, and that's why we're focusing a lot of our immunization program on long-term care facilities. And then hospitalizations are decreasing, and a point there in the data over the last couple of days, our hospitalizations at the county level have been showing as in red. We just transitioned out of red to yellow, but it does appear that the reason we were in red was more of a data issue than anything else. It was not seemed to be some errors in the data coming from the state. So that's a bit of good news. Just wanted to clear that up a little bit. So sorry for the fuzziness of this graphic. I'm still looking for a new orange graphic for us, but we are at level orange. We were put there by the governor on Monday morning. He made the announcement last week, but as of Monday morning, we moved to level orange. In terms of our metrics, we are actually in two-week cumulative incidence rate, we're actually at red. 377.2 is a bit above 350, which is where we need to be in orange. Our 2-week testing positivity rate is at 5%, which is a little bit higher than it was last week, but again, still within that green metric. And then hospitalization status, we just moved out of red into yellow today with that 8 days of decreasing or stable admissions. That's good news. Hopefully we'll see that trend continue. It's a good sign. Jumping straight out of that into the 5-star program. I think I've said this before, but I'll say it again. Thank you, Corinne, for all the work you've done on the 5-star program. The community would not be where it is without the work of the Boulder Chamber and our other chambers, and just really want to appreciate that. And then I don't know if Corinne, you want to talk more about this in particular.
Sure.
Thanks.
So we are in the process. There was an announcement made in the press this week. We've gotten approval to move forward with, forming the administrative committee and to explore submitting an application to CDPHE to stand up a 5-star program in Boulder County. That program will be administered through a third party, and we're working out the details on that. But what a five-star program would offer would be an opportunity for businesses to apply and get inspected in order for them to be inspected under a series of checklist or public health protocols in order to operate at one level below what the metrics of the county are currently at. And so let's just make that sure, so we put a pin in that one. So we want to make sure that we're working on the application, we're setting up the administrative committee, and we're putting together a program right here in Boulder County. The plan is that the administrative committee is actually meeting today to see if we can put that application together and try to submit it. We do not currently have the metrics to be able to operate a program below orange level. So if we did submit an application, we would not be able to allow any businesses to operate below orange at this time anyways. So we're just trying to put together the opportunity to be able to set up a program here in Boulder County, to be able to get the infrastructure state set, to be able to take the pre-applications, to be able to recruit the inspectors, to do all of that locally, so that when our metrics do hit the level in which we are at legitimately orange for a period of time, that we have the system in place to be able to allow our businesses to operate in that one level below what our metrics are at. So all three of the dial metrics need to be in orange for at least 7 days straight in order for us to be able to allow businesses to operate in yellow if we are approved for the five-star program. So I just wanted to clarify that. But just like I said last week, we are at that level where we're working with the municipalities, we're working with the county commissioners, we're working with Lane and the Boulder County Public Health, Jesse, on really making this program, standing this program up here in Boulder County. There is an interest form for businesses to fill out, because we need to understand how many resources, how many inspectors we need here in Boulder County. There will be an application fee. It is a $100 application fee for businesses, one-time application fee to get inspected. You will be inspected every 8 weeks, and it is a live inspection. So I just want to put that out there. But so there is an interest form. I'm going to put it in the chat. We do need to understand how many businesses would be interested in this program, so we can understand the resources we need as a community. We will inform you more as we go along, including when we do submit the application to CDPHE. But we are moving forward, and we have a great team of people, and we have a great administrative committee that will be meeting. So we will, if you have any questions, you can email me, but just know that, as I said last week, this was a group of a lot of stakeholders coming together, trying to put together a program for our community. It couldn't be led by public health, because public health really needs to spend their time on reducing the spread of the disease in our community and rolling out the immunizations. So we needed to bring together our municipalities, our chambers, our EDCs, to really try to stand up with this program for our businesses. So we will take questions when we, if you have them, but otherwise I will put the link to the interest form in the chat.
Thanks, Corinne. So moving on from the five-star program, let's jump back into the dial. Let's see here. So we are at level orange. We were put there by the governor as of Monday morning. I saw a question in the Q&A. We can get into this at the end, but we, just because we're in orange now, our metrics are showing that we are in red at this point. So we could fall back to red, and there's still some discussion at the state level about how that will happen, if that will happen, the mechanism for moving out of this instituted orange. But the real solution to that problem is to get our numbers to orange, and then we don't have to worry about falling back to red. So that's our goal, is to get the community to orange or better. So just a bunch of reminders. I'm going to go through this. We went through this last week, and we'll do it again today. But I think it's important to see that. So again, the level orange and all of the levels are really about capacity changes. So most sectors increase to 25% capacity, and then your the number of people in your larger facilities increases as well. So retail remains at 50% capacity regardless of whether you are critical or non-critical retail. Manufacturing may operate at 25% or 50 people per room, whichever is less. Personal services and limited healthcare at 25% or 25 people, again, whichever is less per room. Gyms, and this is a change from before, so I really want to point this out. Gyms are 25% or 50 people per room. So this brings you in line with restaurants. So just a larger number of people can be in those rooms, those larger rooms. And it is still whichever is less. Restaurants. So again, 25% or 50 people per room, whichever is less. 10 people per group outdoors. And in Boulder County, those 10 people can be from only two families, two households, basically. And on-premises alcohol sales are until 10 p.m. That's under red, we were at 8 p.m. So that's a change there. For indoor events, 25% or 50 people, whichever is less, and then your occupancy is defined using the social distancing calculator. Seated events have a higher capacity because as long as you can maintain 6 feet between households, 6 feet or more between households, you might be able to have more people. And a reminder there that your higher capacity really depends on how much space you have. And a seated event has to be seated the entire time. It's not some seating suddenly allows you to have more people. Open houses, and this is for field services, but open houses, real estate open houses now follow this guidance, the indoor events guidance. So in other words, you are allowed to operate open houses more like a traditional open house would work under orange. Outdoor events, same rules as indoor events, but you can have up to 75 people in spaces that are large enough using the social distancing calculator to have 75 people. For sports, indoor organized sports, rec league, adult, doesn't matter, youth are not permitted. That's practices where you're actually playing the sport or games are not permitted. And outdoor sports, 10 or fewer on a field, social distancing must be maintained. You have to wear a mask. So that can continue outdoors. And it's still at that 10 or fewer people per sport or per field, sorry. So caveat, school-sponsored sports. And that's what that asterisk on the last slide was about. Sports and activities overseen by CHASA and in Season B can begin practices on January 18th, and matches, games begin in February. I don't have a specific date for that, although I believe there is a specific date. I'll try and update it for next week's. And outbreak practices need to follow school guidance. So that's a very different thing. And to note here, important thing to note here, in Boulder County, wrestling is not permitted. So that is a Season B sport that public health has asked, because of the increased danger to participants, that not be permitted in Boulder County. Switching gears completely to small business grant programs. As far as I know, and Corinne, you may know better, this is not open yet.
It'll be opening, I believe the application will go live either tomorrow or Monday, and we'll send out an email about it.
Perfect. Thank you so much. I checked last night and didn't see anything, but I probably was looking in the wrong place. So this is eligible businesses are restaurants, bars, caterers, movie theaters, and gyms. And there are some restrictions for size of business to note. And the grant amounts will be between $3,500 and $7,500. Applications will be accepted for 21 days. And the restrictions and the short periods and all of that are really have to do with how the money is being dispersed by the state. the state is making these decisions. We will be the dispersing group, I believe, but and by we I mean the county, but it is coming through the state. And if you have questions, you want more information, check this link. Corinne has been putting this link in her emails lately. Please follow that, check it. If you have questions, you can email Boulder County, I believe, as well as Corinne. I don't know if you probably have a lot of emails. Maybe don't email Corinne. I don't know.
You can email me. I've been sending them to somebody that's on this task force to answer the questions. It's perfectly fine, but they will be putting out a frequently asked questions, and they will be opening the application for this pretty quickly. Everything is in the state statute, and I did get a lot of emails last week about why not this industry, why this industry. It was put into the legislation when the special session came in and they announced this. It was not a county decision. It was a state legislative decision as to which industries would be covered under this grant. So I just wanted to mention that. If you are in one of the industries that are not covered by this, but you want some information on where there may be money available, especially under the new federal stimulus, under the new PPP, or the EIDL grants that will be coming out, the Small Business Development Center in Boulder County has been really great about answering some of those questions about how you access some of that money that's coming out. There will also be a town hall with Congressman Nagoose next week that I will put into this upcoming email that will talk about how to access some of that federal, some of the federal funding that's going to be coming out. So I know a lot of our personal services have been reaching out to me saying, thank you for everything you've done, but I'm not able to access this. How do I access some of the other information? So I just wanted to point that out. So I've heard you, I've seen the emails, and either reach out, we can forward you to the Small Business Development Center, but there's also some additional resources or webinars that will be coming out.
Great. Thanks, Corinne. So moving on from that, I just wanted to update everyone on the vaccination schedule. So we are still in phase 1A. We're still working on frontline healthcare workers. We expect phase 1B to begin before the end of January. And if you are in phase 1B, if you believe you're in phase 1B, I encourage you to check the state website, covid19.colorado.gov//vaccine for details there, but also on the Boulder County COVID response website. There's a subsection on vaccines. You can sign up there to be informed when you would be eligible to go. It's not a perfect system, but it'll help. There's also, if you are a healthcare worker who does outpatient work, there is a Survey Monkey form there that you need to fill out that would get you onto the list to be informed when your chance to be vaccinated is. And Corinne, looks like you have more.
Jesse, I put the link to the Boulder County vaccine site into the chat, and it includes the sign up form, especially for the 1B. And I think it's good to clarify that there's a dotted line on the 1B that the above, I'm getting a lot of questions about this, that the above the dotted line have to go first. So the 70 plus and the healthcare workers have to be vaccinated first before they move on to the below the dotted line, which are the teachers, the essential manufacturers, and so forth. And there are a lot of individuals above the dotted line. So sign up on that list. You'll be notified. There is a place where you can indicate where you fall into the different categories, but just know that they're not going to get to essential manufacturers tomorrow, but because they have to get to the 70 plus and so forth above that dotted line first. So I just wanted to clarify because I do get a lot of questions about that.
Yes, absolutely. And another point of clarification I think is important, and that is that if you're not sure where you fall, take a look at the state website, the county website, and if you still have questions, don't hesitate to give COVID Biz an email. We're going to just forward it on to some of our colleagues because we don't make the determination where you fall, and really neither do our colleagues. We're looking at the state regulations to see where businesses fall. And there certainly is a lot of vocabulary that you need to understand to make sure where you fall, but sign up, give a best estimate of where you fall in the categories, and we will be in touch. We are trying to get out to everyone as quickly as possible. With the supply of vaccine the way it is moving slower than we expected. But we have stood up a lot of, I want to shout out all of my public health colleagues who've done an amazing job standing up a ton of vaccination opportunities, and I'm super impressed. I really appreciate all the work they're doing. So we will get to you, I promise. And just one last note: phase 2 will not likely start until March. So if you're falling into phase 2, we're getting there. We're doing the best we can. And that's really all I have. Just going through the last couple things here. Exposure notification system. I think Corinne mentioned this last week or maybe the week before. Part of your 5-star application is talking about how much we are advertising and asking people to join the exposure notification system. This is a really great tool to try to track the spread of the virus. It also is a very nice thing to feel like you've got some assurance when you're going out in public. If everyone else is using this tool, we can all be a little bit safer. It does not protect you in any way, but it gives you more information, which is in some ways a little bit of protection. And it is, they continue to answer questions about the privacy aspect. And if you go on that website, there's a lot of information about the privacy protections. Again, if you're here, I'm glad you're here, and you know that we moved to Thursday a couple weeks ago, and we are going to stay on Thursdays at 1 p.m. And our special sessions are on Friday at 11. And this week we'll be doing sports, and it's sort of a broad term, but I think that's on purpose. I mean, I know that's on purpose because I made it up. And that means we're going to talk about school sports, rec sports. We don't really have any professional sports, but if there are collegiate sports questions, and your amateur league, if you have those, to just try and drill down on what's allowed under orange, what's allowed under different levels, and then what the various variances that are in place now mean for different sports. Also questions about how sports are impacted by the 5-star program. So there's a lot out there, and we're going to try and dig into those questions tomorrow. And with that, happy to take questions.
Okay, well, we have quite a few. So we'll start going through it. I'm going to start with some vaccination questions so we can get through those. So I tried to cover some of this one, but I'm going to ask the question anyways. Can you, the rollout plan for phase 1B, is there any documentation necessary to support eligibility for the different categories within 1A or 1B?
When you fill out the forms, I don't believe we ask you to submit any sort of evidence one way or the other. That's as far as I know. I don't know, Lane or Corinne, if you know more about how that form works.
Yeah, I could just say in general on vaccines, that is not what our team is doing. So really, we're going to direct you to the websites. I think as providers are brought in to do those vaccines, there probably will be mechanisms. Healthcare providers know the various underlying conditions. They can obviously verify age, some of those different pieces for the people that qualify. And then as it gets into various sectors, businesses working with providers to help vaccinate their employees, that will help facilitate that. But that's not going to be a role that our team plays, is to get into creating lists or linking businesses up with providers to get shots. That's not going to be a role our team is likely going to play.
I got some clarification earlier that, because the notification list is an individual, and I've gotten some businesses reach out saying, well, as a business want to, get notified. I think they're still working on plans to notify maybe some of our larger businesses as well. But what they did suggest is maybe having one of the business people, sign up, maybe the COO or the CEO sign up to be notified. as a business participant at this time. So just maybe have one person on the list, maybe from some of our larger businesses. It is going to take a little while, and by then they probably will have a plan in place for some of our larger employers that fall in some of those categories. So instead of having all 350 of your employees go in and input their names individually at this time. The link is up. I've heard that some other counties don't even have that opportunity up. So I want to give Boulder County a shout out for having that. I've also heard that some of the hospitals, if you are a patient in some of those hospitals, they're starting to notify a lot of their 70 plus and, starting to set up opportunities to go in and get your shots when they're available. So it's one of the statistics that came out is that 1/3 of the state's population now falls in the 1A, 1B categories. So that's a lot of people to immunize within the 1A, 1B categories. So just to put that in everybody's mind for that. All right, so let me see if there's any immunization questions. Our staff works with homeless population. Will we be able to get the vaccine as a group, or should each employee sign up as the county notification sheet?
I think this sort of goes back to your point about businesses signing up as a group. I think it's important to have your individual employees sign up. I think it also does through the SurveyMonkey form. I believe you can indicate that you're the head of an organization, but your individual employees will need to sign up so that they can be notified individually.
So, and then the question is, how will businesses be working with providers? I think that, that's still being worked out. School districts already have existing relationships with certain providers. So I think that some of that's being worked out. And I know that there's going to be some announcements with certain providers that are going to be available. So do you have any additional insight into that?
Nope.
Do you have any idea about the depth of essential workers or essential retail or some other, the other categories that fall under phase 2? I know that grocery workers and essential manufacturers are in phase 1B. Do we have any more clarity as to what essential workers in phase 2 might entail?
I don't know. I think the way that the state has, the way the state identifies it is frontline essential workers are phase 1B, and then non-frontline essential workers are phase 2. They don't define what frontline means anywhere, but I would expect that if you or some of your employees have regular contact, are essential employees and have regular contact with people who you cannot be sure of their COVID-19 status, then those might be frontline essential workers. Whereas if you have, for example, and I am an office worker, so I'm going to say something about office workers. If you work in an office by yourself and you are essential, but you have no contact with the public, then you're probably not a frontline essential worker.
So most likely, because a bike shop or a bike repair is considered essential retail, that probably will fall under that phase 2 because it's listed under the essential retail. But caveat, phase 2 probably will not start until the spring.
Yes. Yep.
Okay. And by then, there'll probably be more definition, more dotted lines, more prioritization, more plans put in place.
Yeah.
As things roll out more. Okay, so the grant program really quickly. I got a question about personal services. Are salons eligible for the statewide grant that's being brought in through the counties? And the answer to that is no. That it is specific industries, but this is where, again, let's try to, send me a question. I'll send you off to the Small Business Development Center, and they might be able to help you with some of the federal monies that are coming in through new EIDL and PPP grants that will be available through the federal stimulus plans. So unfortunately, personal services was not included in the industry. So I apologize for that. We did advocate for it, though, I will say. There was a letter writing advocating for it. All right, so let's ask a couple questions. So that now that the governor has changed the criteria and moved us to orange before our metrics were fully in orange for the required amount of time, how do we know when we would move to red?
Well, you know, what we will do is continue to monitor our metrics. We, as Boulder County Public Health, are going to report out every week where we are. We're going to be watching this, and we will, if we see ourselves sliding towards red, you know, we're going to start preparing mitigation plans. However, as I said during the presentation, we do not know what the process is at this time for moving between levels, or move if we were to stay in red for an extended period of time. If the governor would move us to red without any process, because he moved us to orange without any process, and he also moved us to red the first time without any process. So I guess what I would say is there is a system in place in the public health order for us to create a mitigation plan, and then there's a 2-week period where we try to work that out, and if that fails, then we move to red. However, that has never actually happened for us because we've never actually had to follow through with that. So
there are opportunities for Boulder County Public Health to put surgical additional restrictions on the current orange order,
right?
Just like we're in place for the 3 days prior to us moving to orange, from orange to red,
right?
In order to hit and control certain, if we were to have certain spreads, those are always opportunities. There's always more restriction allowed by both the county. And again, we don't know. There's stuff that's outlined in the order, but you guys have detailed that out. We've detailed out the processes, but we've also seen that it's happened both ways.
And I think just to close out on that, we are actively working with the state to try to identify what will happen over the next couple of weeks. So we're on top of that. We're chasing it down, and we hope that our practices and the practices of our business community will help us stay at orange.
And to answer questions, there's questions about the 5-star program. So the way that the 5-star program works is that you can't be a business cannot operate 2 levels below where the metrics are. So even though we're in orange, our metrics say we're in red, you cannot operate in yellow. But if our metrics were in orange, a business could operate in yellow. If our metrics were in red, a business could operate in orange. Let's say we move to red, as a community, you wouldn't have to be re-inspected. The business that is certified would be able to operate in orange. Where we would have to close down the program is if we would have to suspend the program is if we move to purple, or our hospitals reached a certain capacity limit, or we reached a point in our community where there was too much widespread and we decided that our metrics were out of control. We hit 90% ICU. We hit certain metrics that are outlined and detailed in the program, that it was a suspension point within the program. So that's where it works, is that the businesses operate 1 level below where the metrics are in the program. So if we as a community moved up to red, then the businesses would operate in orange. But our metrics are in red, we would still operate, the businesses would operate in orange. So it's really confusing, I know, but the way it works on the state website is if you look at the communities that are in 5-star, if you were to go right now, go to Summit, you'll see that it says Summit is in orange. 5-star businesses may operate in orange. So it does say that on there that they also have where the 5-star businesses may operate at the time. Okay, so let's get through some. There's a question if there's an official list of what essential retailers or businesses are, and that is actually listed in the order. So Jesse, it's in the order under Appendix A, and I'll put the link in. Do you want to clarify, how that's detailed out?
Yeah, so I think one thing, it doesn't list every business in the state that's qualified, but what it says is by industry. what qualifies as an essential business, a critical business. And it also outlines in Appendix A and also earlier in the order what that means for operation. But I assume what you're asking about for the essential thing is for the immunization program. And being a critical business in the order does not necessarily mean that you're in what, it does not directly map to where you are in immunization phases. So once you know where you are in the order, it pays to go to both the state and county websites to look at where you would fall in the immunization program. They are operating slightly differently.
And we've had many opportunities up to this point where businesses have had to figure out if they're essential or critical businesses, to stay open. In some cases, businesses have had to consult an attorney to get letters to prove that they're an essential manufacturer. So there have been a couple points up to this point where businesses have had to try to figure out if they're, essential up to this point. And attorneys may, I've already talked to a couple manufacturers that are still trying to consult with attorneys to see if they still fall within the essential manufacturing category. So, okay, so let's go into some more specifics about recreation and pools. We're gonna go back to the lap swimming. Are we still limited to one swimmer per lane?
So this is an interesting question, and I'm glad you're asking it now, although you should ask it tomorrow at the session about sports. But we had evidence that at one point the state said one swimmer per lane. However, recently our attorneys talking to the state said, what's up with the one swimmer per lane rule? And the state said, oh no, you're allowed 2 swimmers per lane, starting at opposite ends of the pool and swimming past each other. That is now the state's rule. We're asking for that in writing so that we can see if it changes over time. But right now, your recreational pools are allowed to operate at that 2 people per lane, swimming from opposite sides, starting on opposite sides. So they're, the idea is that they only cross for a couple seconds. I also see that there's a question about CHASA swimming and clubs. So CHASA has a special, they got a variance from the state that allows swim teams to practice and compete. That does not hold true for anyone else. Other club swim teams are not part of that. It's just scholastic swim teams that can practice and compete under the auspices of CHASA. So that also means that while they have capacity limits on their teams that are higher than what's allowed on a pool deck right now under the level orange, private clubs and public swimming pools need to operate at the level orange capacity, except if a swim team, a school-based swim team is practicing at their facility or competing at their facility. So there are a number of teams that practice at private and public facilities. While they're practicing, it's a school space, so they can operate at that higher capacity. When they're not practicing, you have to go back to level orange. That makes sense? That was a lot of words, sorry.
No, it made sense.
Okay.
A year ago, Jesse, did you know that you would be becoming an expert in some of these things?
No.
I was just curious because you've had to learn a lot of different things because I know this isn't your regular day job. Is there a place to find guidance on opening hot tubs, steam, and sauna facilities?
Yeah, definitely check the public health order. That has information on it. I don't have it off the top of my head. I was going to try and quickly go there and look, but I think the best thing to do is to go on the covid19.colorado.gov website, and you can look up by sector. But as far as I know, hot tubs are allowed as long as you can maintain social distancing, but saunas are not permitted. Steam rooms and saunas are not permitted.
Okay,
And I think the state health department also has the regulations for pools and spas. So that would be something else if you're building and planning to open new facilities, that those can help guide you in making sure that you're compliant with those pool regulations.
great. Okay, so the next question, I think we need to clarify in two different ways. So the question is, can you clarify per room? But I think this person's asking about offices. So first, let's clarify, because you say, capacity per room, but then clarify the capacity of an office space.
Yep.
So when you say, something is 25% or 50 people per room, when we're talking gyms or restaurants, or in the case of personal services, the 25% or 25 people per room, what does that mean? And then what is an office space allowed to do? Is it dependent on rooms?
Yep. So it's complicated, and thank you for suggesting that we clarify this. So the per room means 4 walls and a door. So if you have a room that has 4 walls and a door, that is your room that can operate at that capacity. In an office setting, this is a bit like Corinne said, very confusing here. If you have a single business office, your floor of that building can operate essentially at 25% capacity. However, if you have a business or a building that is a bunch of different businesses, each of those businesses closed off spaces, door, an office suite essentially that is cordoned off for one business can operate at 25%. Then your shared spaces, your break rooms, your bathrooms, your hallways, your lobbies have to operate at the 25% capacity. So it is very confusing. It has to do with how your space is set up. If it's a building with a bunch of different businesses, it operates slightly differently than one building, one business.
So in the office space, it's 25% of your 25% of, have we gone back to 25% of your desk space, 25% of your, is it back now to the 25% of your space or 25% of your fire code?
It's still 25% of your fire code as far as I can tell in the public health order. We have not gone back to that original 25% of your workforce.
And it doesn't matter if everybody in that office can close their door, 4 walls and a door. You have to reduce the capacity of your space because you have to reduce the capacity of your office.
Yeah.
It doesn't matter if everybody has a private office.
And just sort of from a logical perspective, I think that does kind of make sense. If you're a business, a single business, if you have 25% of your workforce in the office, those people are going to interact. And that's what we're trying to minimize, is interaction. Whereas if you have a bunch of different office suites in the space, there's no real reason that the doctor's office and the lawyer's office next door need to interact at all. So they are considered individual spaces that are separated away from each
other. Okay. Can you touch on the guidance for live entertainment indoors and outdoors?
Yeah. Regardless of whether you're indoors or outdoors, your live entertainment needs to be 25 feet away from patrons who are listening or enjoying the entertainment. There are some caveats. Please check the public health order about using plexiglass separators to reduce that distance, but it is still a pretty large distance required, and that's indoors or outdoors. And Lane, I don't know if you have any follow-up on that. I know that you got to be involved in some of those discussions.
Yeah, I think the only other possible caveat is, this is focused on people that are speaking, singing, things like that. So if it was only someone playing an instrument, there could be some additional caveat where that is, but it doesn't get into those kind of nuances. But that is the risk factor, is the projection from singing.
Right.
But yeah, a plexiglass in front of the singer doesn't reduce the distance Similarly, like you can't put a plexiglass up between booths in a restaurant. It has to be a full wall. So.
Mhm.
And I've heard you guys talk about just being conscious of, the performers. If you have, the when you have a choir or anything like that, when you have the performers, they're maskless. So, keeping it to a limited number of people that are actually doing the live entertainment. You don't have a lot of people that are on stage without a
Yeah, that's
mask singing.
a really good point. When you're in that performance space, trying to maintain distance, having your performers who aren't singing wear masks, all that sort of stuff is important.
All right. Someone holds a volunteer event cleaning up downtown Longmont. They assume they have volunteers that come with staff and they divide them in groups. Can they still bring their volunteers and divide them in groups and work through various locations outdoors?
Yeah,
Will
so
that
that's permitted. I mean, I think that the caveat I would say is remember that your groups need to maintain social distancing, and that means that your group of 5 to 7 people, if that 5 people is one household, they can be close to each other. If they are not, then each individual of that 5 to 7 needs to sort of be separated.
and wear masks,
And wear
correct?
masks. Yes, wear masks. Be socially distant. And just another thing to encourage is if you can provide, um, you know, hand cleaning materials so that as they're going through their day. I know they're picking up trash, but we're also trying to reduce the virus spread.
Another pool question. In order to operate pools, we need certified lifeguards. Can we run trainings?
I don't think there's anything specifically in the order that would prohibit it because they are a health and safety, a vital service. You can do that. I would, whatever you do, you should look at the public health order specifically surrounding questions about training in classes. Because one thing I would say is you are going to need to figure out how to, again, keep people as socially distanced as possible. I know that's difficult. If you're doing specific life-saving drills, there may be issues with that. I don't know, Lane, if you know any more about that.
No, I think for critical infrastructure, so if they need to do CPR classes or something like that, it's just going to require people to be socially distanced. They're going to need obviously strong protocols for cleaning, that mannequins ideally are not being shared, those kind of things. So, or if there's other in-person necessary trainings that they can't do virtually, they're going to have to really limit the size of classes as well as and really ensure that they're taking those precautions and masking people up when they're not performing the various life-saving practices.
Are we attributing the metrics returning to, level red or the higher number of cases to a Christmas spike, or are we still waiting for that?
I think we're probably still waiting to see the numbers for Christmas or certainly New Year's spike. We're probably still waiting on any Christmas, impacts as well. I think what we're really seeing is before the governor moved us to level orange, we were on a downward trend in number of cases, but we were certainly not, headed for yellow very quickly. We were sort of leveling off in the number of cases, right around orange, which is where we are. We're at 377. It's more than 350, but it's not a ton more. One of the things that I think came out in discussions with public health colleagues before the new year was that to return to orange when we were at red, we needed to average 81 cases per day or fewer. And earlier this week, we were at 83 cases. Sorry. We've been seeing between 83 and 100 something cases. So we were not there yet. We were headed in the right direction, but not there.
And I had heard someone said earlier that because they have people signing up for the data on their phones and stuff, they saw more people traveling and moving around Christmas and New Year's than they did around Thanksgiving. So they are expecting, higher numbers and a spike in cases from this holiday over what they saw in Thanksgiving. So they did see more gatherings and more movement of people. All right, we have another question. Along with classes, are body work instruction classes allowed where we do specifics body work?
I don't know exactly. I mean, I think what we're trying to do is reduce person-to-person contact. So if your training requires that you are in very close contact with someone else, it's probably not the greatest idea to perform that. Obviously, masking up, that sort of thing. If this is part of your business to offer these trainings, then that would be permitted under personal services. But again, the less person-to-person contact, the better.
It sounds like it's sort of maybe an employee training for personal services under the massage or under the body art, kind of like the lifeguard training under body art.
Mm-hmm.
All right. Are there any other questions for Jesse or Lane or me? I feel like I became part of the presentation this week and last week. It was you and I last week, Jesse.
Yes.
All right. I don't see any questions. I'm going to do last call for questions. So look for it. We'll send out the recording to this. When the grant does get launched and there's a link, I'll send that out. When we have more information about anything having to do with, 5-star, I will send that out. If there are any changes to orders, just like the gyms and recreation changed this week that happened on Monday, I will send that out. If you didn't see that, it was in my email. I did outline out what the change in the order was so that you can see that each level there was a change. So to be clear, if we have 4 employees, only one can be in an office at a time, right?
Again, right now the 25% is fire code. So actually, if you have a large enough office, it might be higher than that. From a personal perspective, yeah, I think it's probably a good idea to limit it to 25% of your workforce as well. Just again, limiting the number of people in the office at any one time is best for avoiding the spread of the virus.
But that's hard for you to answer because if it's a 30,000 square foot facility and there's, they normally have, have enough space for 30 people and they have only 4 people. But
yeah, yep.
But, maybe 1 out of 4 is a good rule. All right, last call. Otherwise, if you're part of the sports program, that's tomorrow at 11. We'll see you tomorrow at 11. I will take question that came in. I will the thing that just came in. I will make a note of it and send it off.
Yeah,
we will follow up on that one. And everybody else, we'll see you on the sports program if you're joining us tomorrow. Otherwise, we will see you next week on Thursday at 1 o'clock. And have a wonderful weekend. Thank you.
Thanks, everybody. Thanks, Corinne. Thanks, Lane.
Thanks, Justin. Bye.